The most classic sign of a heart attack is, of course, chest pain. This is an oppressive, heavy, pressure-like feeling, usually in the center of the chest, but it doesn't always have to be in the center of the chest. It can be really anything from the lower portion of the jaw all the way down into the upper portion of the abdomen. The symptoms of a heart attack are also often accompanied by shortness of breath, profuse sweating, a sense of nausea, and in some patients, a sense of profound impending doom. For a long time, it has been thought that men and women had distinctly different symptoms in terms of a heart attack. There was a recent study that just came out in Canada that suggested that really the symptoms are quite a bit similar in men and women. They may be somewhat different in older individuals than younger individuals, but the symptoms often are the same in women. You know, in my own experience, I found that to be true, but also sometimes both men and women can just present with a profound sense of fatigue. There's no chest pain, there's no shortness of breath, but people have a very strong sense that just something is wrong and feel fatigued, but don't really have the classic symptoms of a heart attack.
And because there can be varied symptoms and there have been issues where people have waited too long, why is it so urgent that someone seek immediate care even if they start to feel something? Why is that so important?
Well, the most common type of heart attack that we get concerned about the most is called a STEMI. That's STEMI, and that stands for ST segment elevation myocardial infarction. That type of heart attack occurs when one of the major blood vessels to the heart is completely clogged with usually a blood clot. In that circumstance, time is critically important because the faster the artery is opened, the more likely it is the patient is going to recover some heart function and have a better overall outcome. So time is absolutely critical.
So it's important then that if they first start to feel those symptoms, they call 911 or they get themselves to the nearest hospital as soon as they can?
Absolutely. National data, has shown that the average person will wait about 2 hours before calling for help. That's way too long. You know, it's always a careful balance. Nobody wants to run to the doctor unnecessarily for some symptom that really isn't all that important, and to go through all of the effort to get signed in an emergency room only to be checked out and told everything is okay. So we don't want that to happen, but at the same time, when people are really having important symptoms, it is critically important that, number one, they call 911. It's a common mistake for you to turn to a family member, your spouse, or somebody, say, drive me to the hospital, because a lot of people will have serious heart rhythm disturbances, which you really can't treat in a family car. That's why it's best to have your transport done by trained emergency medical service people in an ambulance with advanced life support, so that if that happens, you can be treated for it immediately. It can make a big difference.
And nationally, there is an effort to get some of these patients in and get their treatment a lot earlier. What is Scott and White doing to really help these patients who are coming in?
Starting about 3 years ago, we began first working in our local community and then expanding this out to many of the regional areas close by to develop a program for the very rapid identification and transport of patients here with this STEMI type of heart attack. That program now has been up and running and is really doing quite well, and we're very proud of the statistics. Some of the key features of that program include there's a hotline number that we've made available to all of the regional emergency rooms. Is really one call does it all. And when a patient is identified, one call to our admissions center with this hotline basically gets all the transport services up and running. We have developed standardized treatment protocols, which we've shared with all the outlying emergency rooms. And most importantly, it activates the heart attack team here. And many times, even at 2 o'clock in the morning, it results in our team being here and waiting when the helicopter lands or the ambulance arrives. And those extra minutes saved can be critically important.
And what is your goal for getting the patients in?
Well, time is muscle, heart muscle, and our goal is always to get them here as fast as possible. The national goal is established by a metric that's called the door to balloon time. The door is the door time when the patient actually crosses the door threshold of the hospital, and the balloon is the time when the balloon is actually inflated in the artery, which is the initial thing that we do to clear the artery. We started out nationally with a goal to achieve a door to balloon time of 90 minutes. Many centers, including us, we have just blown past that goal, about a year and a half ago. If a patient comes into our emergency room now, we are almost consistently getting it to be less than 60 minutes. The real challenge has been in the patients that present at outside or outlying hospitals that do not have the facilities to perform emergency angioplasty. In that particular setting, everybody has struggled a little bit, and that's why developing cooperative and collaborative networks of care which coordinate the care, everything from coming into the outside hospital, the transportation, their arrival here, everything is very well coordinated. And doing that now, we, about 25% of the time, even when the patient is 40 and 50 miles away, we can still get their artery open within 90 minutes. And the majority of them, we get open within 2 hours. So that coordination is very important.